My name is Georgia Brown. I'm with Breathe Strong CF, and I have been in the CF sexual and reproductive space for about 8 years. The past 3 years, I have been working in men's sexual and reproductive health. We've received some funding for this grant project, and today I'm partnered with Reuben Samuels, who is a male with CF, who's going to help me discuss this difficult topic. Reuben?
Yeah, thanks, Georgia. I'm about 40. I'm 39, almost 40, with cystic fibrosis. My name is Reuben Samuels. I am the president of Breathe Easy International, and really happy to have partnered with Breathe Strong by way of Georgia in this series.
What I'd like to do is start off with some of the information that we know about sexual and reproductive health. Then I'm going to turn it over to Reuben for him to share his personal story and how these statistics have impacted his life, either negatively or positively, so that we have a better understanding of what men with CF face in regards to their sexual and reproductive health. So let's talk about what we know about men's sexual reproductive health. We know that 95 to 98% of males with CF are infertile. This is due to the congenital bilateral absence of the vas deferens. What we don't know exactly is who is fertile, and we can't know that without a semen analysis. But a majority of males with CF are not screened for infertility. This means that a percentage, albeit small, can have children naturally. Of those interested in parenthood, only about a third have undergone semen analysis. And interestingly enough, there are men with CF who were only diagnosed because of their infertility. There are actually men who are infertile who have copies of the CFTR gene who don't exhibit any CF-like symptoms. So what we don't know is a lot, and it can impact males with CF lives. So another issue that we're going to talk about is hypogonadism or low testosterone. And we know that it can be anywhere from 25 to 88% of males have low testosterone levels. That's a wide variety there. And that's mostly because there's knowledge gaps, there's a lack of research, and standard of care are lacking. Research indicates that there's a potential link between hypogonadism and subfertility. And subfertility would play a role if a male with CF wanted to have a child through assisted reproductive technology. And if they were subfertile, then it might be more difficult to proceed in that procedure of extracting sperm. Researchers don't know to the extent low T impacts male sexual and reproductive health. In general, low testosterone can impact libido, erectile function or dysfunction, can cause lower muscle mass in males with CF, can cause a loss of energy and sleep. And we all know sleep is very important for people with CF. Of course, it plays the role in infertility. It can impair mood and it can impact bone mineral density. And that is already impaired with people with CF. So this could make it harder for males as they age due to a loss of bone mineral density. Because testosterone plays a role in normal sexual function, screening and treatment are crucial to improving sexual function. But it also is not just the act of sex, it is the health of the body. So those are two very important distinctions. It's not just to have a healthy sex life, it is to have a healthy life and a better quality of life. We know that with modulator therapy, the number of pregnancies has increased, and more males are using assisted reproductive therapy to have biological children. But not all males are aware that this is an option because this can result in biological children between the male with CF and their partner. There is little data on how parenthood impacts either men or women with CF, and this can impact the decision making. Is it beneficial? Can it make me more sick? What about my energy levels? What about my income potential? There are a lot of factors in play. So there is a large scale study underway, and it seeks to assess the role of chronic disease in parenthood. And this can help for future generations with this decision-making process. So let's talk about some concerning issues, and Reuben can touch on these as well. Only about 34% of males have been tested for sexually transmitted infections. Um, these are not great things that you want to have in addition to your CF. And even though males with CF are infertile, condom usage is important to prevent STIs. And only about 24% of males with CF report condom usage. And this is concerning because of the fact that males with CF have the same amount and the same kinds of sex as their peers without CF. So you're looking at a percentage of the population of CF, which is over 50% male, who are having sex with their partners and they're not being protected for sexually transmitted infections. Only about 14% of males with CF report ever having received STI counseling. And this is important because males may not be aware they run the risk of STI. They may not be interested in wearing condoms because they're infertile, but they do need to be aware that sexually transmitted infections occur. And if you're not careful, they can negatively impact your health. So Breathe Strong, like I said, has been working in this space for 3 years. We have been funded through the Cystic Fibrosis Foundation. We have received impact awards, and we are now received a community support grant. And our next meeting, which Reuben will talk about more, we usually hold those in the evening, hoping everybody can partake after work. For more information, you can go to our webpage, which is breathestrongcf.org, Men's Reproductive and Sexual Health. You can find all of our resources, some previous videos that we have done on sexual and reproductive health for men, and other documents like our chapter in the CFReSH, or Cystic Fibrosis Sexual and Reproductive Health Collaborative Guide, CF and Male Health, an overview of male CF sexual and reproductive health can be found on the CFReSH website, that's cfresh.org. You can look up the SRH guide and specifically CF and male health. Now, I would like to take a minute and talk to Reuben about some of these issues and turn it over to him as a male with CF, and to really help shape the discussion and why these topics are important, how they haven't been addressed, how we uniquely address them with our collaboration, and to humanize what I just viewed factually, and help us understand the actual impacts of these numbers and factoids.
Thank you. Yeah, there's a lot of information there. There's a lot of facts, a lot of data, and I think often, at least in conversations with physicians, so here at BEI, a lot of what we do is communication, and a lot of it is not just. I think people generally think, well, communicating with patients, and that's very true. And a lot of it is, like you said, humanizing this information to patients and really arming patients with quality information and things that will benefit them right out of the gate. We try to be actionable, and that's one of the big, I think, takeaways of this Men's SRH series, is that we really try to provide you with some action items every single session, so that at the end of the session, you're not left with, okay, what do I do now? You're left with, oh, I think I can do some of those things. I think I know where to go now, or I think I know how to find more information or advocate for myself better, or whatever that looks like. And so, yes, we communicate with patients, but we also communicate a lot with physicians, and seeing both sides of that coin in conversation with regards to CF is a breakdown of that communication. And we often find that physicians operate in fact, operate in science, understandably, right? That's the institution, that's their education background. They need to rely on science and sound data and information. But often we find that there's a little bit of a loss of the human element. And when a clinician or pulmonologist or something like that sees a lot of patients, it's very easy to just kind of follow the numbers and move forward in each patient interaction. But what we're also finding is a lot of these numbers that we're talking about, that Georgia mentioned and that you guys saw on those slides, is not even information that's really in the hands of a lot of clinics. And so if these clinics don't even have a lot of this data, that they're not made aware that men with CF are dealing with a lot of these issues, then it can't be addressed. And if guys aren't aware, which we've found by and large are not aware that these are issues, most of us guys know from a fairly early age. I say most because we are still hearing stories of patients that find out they're infertile in their 20s and even 30s. Some of these guys are married and wanting to have children and can't figure out why they haven't had kids. And they go for testing and they find out, not only are you infertile, but you have cystic fibrosis. And in this day and age, that seems crazy that they wouldn't know, but people are still discovering it that way. And so we are finding out also that there are CF patients out there that don't know that infertility is a piece of that. But by and large, the most exposure, the most conversation around men's sexual reproductive health within CF is around infertility. And there are some wonderful organizations and resources that are offering sperm retrieval and IVF and these types of things to allow more CF families to have children and have biological children. And that conversation is fairly prevalent within the CF community. In fact, in a lot of my conversations around urology, specifically for CF males, you hear a lot about infertility. Oh yeah, I know all about that. I've heard from physicians. I've heard from directors of CF clinics. Yeah, I know. We're addressing infertility. And I'll say, but what about the rest of it? What about the rest of the conversation about us as males with CF? And that's usually met with a bunch of question marks, or that's not in our scope, or that's something for a urologist. And then I've spoken to urologists that this isn't on their radar either. And that really goes back to sort of my lead up into this space. I had questions about my sexual health and even my own development as early as my teenage years. And as I started to see things are different than what I've heard anecdotally about with other guys. Or, man, is this, am I really having this issue, or is this just in my head? Decades of dealing with that, and eventually 7, 8, 9 years ago, starting to get some answers, and really only 6 or 7 years ago, being taken very seriously in this space after years of advocating, years of gaslighting, even to the point where I was convinced that I was making some of this stuff up. I began gaslighting myself because I had been in too many conversations in CF clinics in hormone clinics and in other different wellness clinics and places where people said, I don't know what you're talking about, to where I was essentially convincing myself that I was making this stuff up. And it wasn't until I started to find some actual answers and actually find that one physician or that one wellness clinic that said, no, 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 this isn't made up. This is real. That I started to go, how many other guys out there are dealing with this? And so that really opened up the want to know, am I alone? Am I the 1% or whatever that's dealing with this? And what we've found is that's not true at all. In fact, it's actually a majority of the CF male population that will have or do have some amount or all the spectrum of these issues that we talk about in this series, and many of them that were alluded to in that data. And so we're not alone. Guys, you're not alone in this. Parents of males with CF, they're not alone. And just knowing that I'm not some anomaly, I'm not the one guy that they're not going to take the time to listen to, but there's actually thousands of us. That's right, thousands of us. Most of them, though, are suffering in silence, and many of them don't even know that these are issues, like me almost 20 years ago saying, I don't think this is real. I think I'm making this up or whatever. And so we've really, through my journey, bringing me to a place of advocacy, and now we have a men's health education and wellness team at BEI that is advocating and educating in this space, not just patients, but also physicians. But the space we're talking about right now is for you, the patient, to arm you with information to live better. And that's really our goal here. We're talking about sexual reproductive health, but we're talking about health. We're talking about life. We're talking about longevity. And even our first session in January that Georgia had up on the screen with that link, you can go to breathestrongcf.org. We would love to have you in those sessions, but that first session is about the building blocks of you as a male with CF. And so it's very topical information. We're going to talk about nutrition. We're going to talk about fitness, how to build mass, how to build strength in the face of antibiotics and lung infections and malnutrition and all the things that we deal with. But it's very targeted. It's specifically around males with CF. So you're not going to hear just general health information. Not to say that that's bad, but you can go to any men's health magazine and read about men's health. You can go to any healthy eating website and read how to eat healthy. But why come to our sessions? Why sit in on these classes? Because we're talking specifically about how to improve your life. And not everything can be done, right? We're going to give you a lot of information, but my hope is that after that session, you can pick one or two things and maybe be 1% better. And then after that second session, maybe 2% better. Maybe at the end of our series, you walk away going, I've got some real tools to live longer, enjoy sex better, and be overall healthier. And that's really our goal here. That's really our heart, is to positively impact as many patients as we possibly can, and also bring awareness by way of the patients and actually a lot of the wonderful physicians. So we bring physicians in as well. So every one of our sessions, we have a physician as a guest that will bring some science, that will bring some information, and then we do some Q&A. And these are confidential spaces. They're spaces where you are welcome to be however you need to be. And we understand that this is a hard topic. This is tough stuff. We know the stigma around it. I continue to live the stigma. My two other guys on the team that we moderate these sessions through Breathe Strong is our own lived experiences. So when we're saying we know how uncomfortable it is to talk about your junk with a doctor, it's because we've done it over and over and over and over again. And we've been gaslit over and over and over again. And we don't want that to continue to happen. And so we're hoping that you don't have to fight for 20 years for answers, that you don't have to go to 9 different clinics and leave your CF care team and find all these other resources, that you can skip some steps, that we can arm you with really targeted stuff and that you can do better, because testosterone's not just about sex. It's about supporting your entire system. And in fact, we don't just talk about testosterone. We do a deep dive into testosterone and hypogonadism in session 3. But to get to session 3, we're going to talk about total health. We're going to talk about fitness. We're going to talk about nutrition. And then we actually talk about total hormone spectrum. We have Dr. Anthony Evans coming on. He's going to talk about that. He is a functional medicine and chiropractic doc. And he's going to talk about, what does your whole hormone picture look like? And that's even a subject that often gets overlooked. We talk about insulin because of CFRD. We talk about those different things in CF clinics. But when was the last time you were in a clinic and they talked about cortisol levels, stress hormones, estrogen? As guys, you need to know what estrogen is and what it does in your system, because some of the hormone imbalances that we've seen and that actually studies have shown, it's not always just a low testosterone level. Many of us, because of the medications we're on or the stress we're under or just a number of different factors, actually have elevated estrogen. And having high estrogen and still having a good testosterone level can exhibit symptoms of being low T. And so that's where we even caution guys in this session, don't self-medicate, right? Understand what's going on in your body, understand the science, eat well. Here's some great things that'll improve your sex life. It'll improve blood circulation where it needs to be, but it's also going to improve your overall health. So those are building blocks you can take and you can walk with on your own. But when it comes to testosterone and it comes to these different chemicals and different bioidentical hormone injections and things like that, you have to be really careful. And so we'll talk about pitfalls. We'll talk about optimal options, treatment options, resources for you, things that you can ask a physician, that you can find a urologist. And so we're really trying to boil this down. There is a lot of information. I mean, those slides that Georgia showed you is just a very, very compact version of the mass amount of data and studies that we comb through, that we work with physicians in to really boil it down and make this series effective. And a lot of that has been because we've lived it. So it's really exciting to be in this space, and I've really appreciated Georgia. She's been fantastic and really helped with the logistics, and really a lot of those SRH documents, she's been the one that's typed that out. She's been the one that's gathered a lot of that research data. And then me and the guys, we bring the team and the men's perspective and the human perspective to really round out that information. And so it's been a really good collaborative effort. And we are in our 3rd season or our 3rd series, and every year they get more effective. And the only way that they get more effective is by doing it and by having you folks attend it. We regularly take surveys. We take a survey after every single session. What are we doing right? What are we doing wrong? Are we connecting with you in the way that you learn and the way that you understand? Or are we missing the mark? And the only way we know that is if you show up. And it doesn't hurt to have a $25 Amazon gift card as a possible win. We've thrown that in there this year, just as an icebreaker. We want you to bring other guys, right? I know hundreds of CF guys online through social media because that's how we connect. But getting those guys to actually show up to this class, even though I'm one of the main speakers in it, is like pulling pubes. It's like pulling pubes, if we're going to be honest here. It sucks. It's rough, right? And that's the kind of stuff that we laugh about in this thing. You're going to hear dick jokes. You're going to hear innuendo, but that's going to lead you in. That's going to break that ice, that we're all understanding that this is a sensitive topic. This is a tough topic. These are deep, deep issues. They have social impact. They have mental health impact. In fact, one of our sessions specifically talks about that. And so we understand this stuff's hard, so we got to laugh about it. You got to be a little bit vulnerable. And if you want to stay quiet the whole session, that's okay. If you were the kind of person that just wants to be there and absorb it, great. But if you want to interact and you want to ask questions, that's more than welcome too. We just want you there. We want to arm you with these tools, really, to do better, to live better. And we really feel like the male community has been underserved, and that's not to discount the female community at all. In fact, there is a women's SRH section of the CFReSH website as well, and it was actually established before the men's. And so we want people whole. That's my biggest goal, and I believe that that's the goal of this collaborative effort, is to see more patients whole, not just in the hospital, not just in the clinic, but in everyday life. And I really believe that we're doing that, and I'm excited about it.